scientific, collaborative, translational, transformative, technological extravaganza that we have had.
We have one more panelist, Dr. Lata T. Please come on to the desk.
Wonderful.
Madam, sorry,
welcome,
we couldn't
welcome.
incorporate your photo, but it's okay. Just now you completed a talk. Please. Dr. Lata T. After this, immediately valedictory. So we have a lot of prizes. So please stay back. Don't be in hurry. You have spent 2 days. So we are asking to stay back for 30 minutes. Your valuable 30 minutes. And know whether your presentation could grab the prize or not. Thank you.
So Dr. Lata, very, very warm welcome to you. So we are going to have a very interesting panel discussion which we just put together. And it's all about the buzzword which is AI, artificial intelligence. So I would like to pose one question to all our panelists here. So in your own respective domains, what would be that one translational or technological roadblock which the artificial intelligence, AI, has helped overcome? What would be those roadblocks in your own domains? If you can explain, please. I would request Dr. Sylvian to start off. I want to switch it on.
Very interesting question, in fact. So I'm working in a university hospital, and we are using ER already to collect information from the medical record, and also to help when we have a meeting and interview even with patients, the ER help us to do the record and also the reporting of that. But we don't use ER for prescription or for diagnosis yet. We'll see in the future. And for the research, in research we use a lot ER for big data handling and also to help us to, for reports. But when I ask, for example, ER to write a research project, the structure is good, but what is inside is not good because it's based on all the information. And when you do a research project, you want to focus on a small thing. So it cannot do everything, but definitely it helps us to be more efficient. But to be more efficient, you need to have the knowledge before. And the risk is that, especially for the students, if you rely on the ER to do your job, then we will have a problem, I think.
Thank you. Professor Mike,
thank you.
Your views.
It is a very interesting question, and I'm going to answer it in I guess, 2 parts, and that's based on different roles that I have as a pharmacy educator and as a pharmacy clinician. So I think as an educator, there's a lot of potential benefits for AI, both from our standpoint as educators, but also from the student standpoint. I have to admit I've used artificial intelligence platforms to help prepare presentations and lectures, and I may be accused of being lazy by doing that, but it is very, very helpful to at least get some basic information. the potential concern, and certainly we tell our students that AI platforms can be great tools to help them in their studies, but they cannot replace what they're doing. So there is that concern, and maybe this is a barrier from the student side or educational side, that AI could be used as a way to cheat or to sacrifice academic integrity. So there's that concern. Now, in the healthcare side, there's certainly many potential benefits, and I think using artificial intelligence to gather information, whether it's gathering research evidence or publications regarding some clinical question, or analyzing large amounts of data, can be very, very helpful. But one of my concerns is that the AI technology today, and I don't think will ever fully replace the human brain, and certainly those of us who work with patients know that patients are very complicated. There's a lot of nuances to patient care, and while AI can be a great tool for us to help make decisions, I think it's we humans, whether it's physicians, nurses, pharmacists, whoever the clinicians are, it's we humans that have to be making those decisions for our patients.
Dr. Paul?
Yeah, thank you, Major Guru. Yeah, I work in anti-infective space, so I can look at the role of AI in 3 parts, and all of them are a win-win situation. I say win-win because first is when you're inventing a molecule, the journey is anywhere between 10 to 15 years. So you don't have to go for 15 years anymore. So you can do virtual screening of the compounds. You can design the compounds virtually and look at its binding to the target. Everything, maybe we'll reduce it to 4 years. So you're saving 6 years. And second thing is, you don't have to do so many animal experiments and try out everything by yourself in the wet lab. But before you go to these animal experiments, you can always go to AI-based tools and you simulate it. And the PK, PD, everything we can do by simulation and identify the potential properties, and then you verify them. And the third benefit of that I see is sustainability. So in the ecosystem, I think it's less taxing to the entire universe per se when you fast track it, and at the same time, microbes which would take very less time to develop resistance, right? So we don't expose too long to them before we come to that stage. So all these 3 benefits I see. But the caveat here, there is a danger as well. The danger is our human brains. We may become dumb very soon if we depend too much on that to decide for us. We reduce our thinking. Now what happens when you see an experiment and you look at an outcome, you think, what happened, why it happened? And now that thinking ability will start reducing in us because the machine is giving me ready-made answers. So that's one major caveat I see, otherwise mostly benefits. Thank you.
Wonderful. So AI can really accelerate our natural stupidity, isn't it? So wonderful. Dr. Lata, your views, please.
Yes. An hour ago, I was explaining how AI can be integrated with the One Health, and that helps from the grassroots level. Probably I would share one more, our own project. What currently we are doing with AI is that, when we do the patient handover, the shift handover, basically I'm a nurse. So when we do the shift handover from one shift to another, so we are developing an AI-enabled handoff using the S-bar technique. S-bar is like situation, background, assessment, and recommendation. And we know that until and unless we hand over the patient properly to the next, the nurse in charge of that particular patient, some of the information would miss, though everything will be written in the case sheet, but sometimes, in the busy schedule, many a time we have the staff shortages and nurse-patient ratio is not maintained, and there are so many issues where the proper handover is not happening. So we are developing an AI-enabled tool which takes up the S-bar, situation, background, assessment, and recommendation, that helps in, the handoff will become easy, it saves lot of time, and that is how we improve the patient care. So this is what we are currently doing. And in nursing, we have wonderful areas where we can include AI and then develop many aspects which improves the quality care of the patients. Thank you.
I'll come a little closer to you for the next question. So given that, Dr. Lata, you just highlighted how time-saving artificial intelligence can be. We'll come on to the next question with the AI modules that are getting trained in multimodalities of, let's say, hospital management. It could be nursing management, it could be lab management, it could be radiology. So many aspects of managing a hospital. What could be those ethical considerations that we should be looking at? How careful should we be when we are adapting and adopting AI? Your views on that, please.
Yes. This is one of the worry we have. Even when we started doing a project, the major question raised by the IEC, Institutional Ethics Committee, was that what is the data security? How do you do it? Yes, data security is one of the thing, like, the threat we consider it. But there is, I think today also there is a release of an article which says that how can we have the secure data. I could not read the whole thing. This afternoon only I got it. So it is possible, and we have, CDAC system which is there with the government, the Ministry of Health and Family Welfare has adopted it. So when we include, like we have HMIS is taken into this app, and then AI is trained with the dummy data initially, and then we see how it goes. So data security is definitely taken care. Okay. That is the major threat. Other than this, I don't see any other major threat until and unless the proper training is given for this AI tool.
Perfect. Perfect. Dr. Paul, your domain, any views on ethical aspects of adapting artificial intelligence?
In my domain, you mean?
Yeah.
I see positive benefits of ethics here because machine does not think beyond what we have fed in. If the information and the guidelines what we give to the machine is the right direction, it will make a decision based on that. At the same time, for AI to be beneficial to us, it is not the answer that it gives. It's the question, the way we ask it. Otherwise, if it tells you, okay, you cannot dissect this mice, for example. And if I repose the question, I need the mice to be dissected for this result. It says, excellent point. It is better you dissect it and it is going to play with us.
Yeah.
So when it comes to ethics from using AI, you have to be very cautious that you do not make the machine to respond to the way you want to listen to. So I always tell in research, never look for answers. You ask the right questions and look for data. When you look for answers, you're always manipulating because you want what you want to see. When you look at data per se, that is the truth. So seeking the truth when it becomes the driver, I think ethics gets balanced out with your non-interference in AI.
Beautiful. Absolutely.
Thanks.
Dr. Mike.
I'm happy you mentioned that issue of how to ask appropriate questions. I don't know about your social media feeds, but every day I'm seeing on my social media, come sign up for this course on how to ask ChatGPT questions. So, obviously it's an important thing to make sure we're asking the appropriate questions. But I think from an ethical standpoint, I mean, there's all kinds of issues to talk about. Certainly in a patient care setting, patient privacy and privacy of their information is really, really important. And we really have no idea with the AI platforms, how such protected information might be utilized or how it may, whether it would be continued to be protected. So we have to be very, very careful to make sure we're not putting any protected, private protected patient information into an AI platform. But you know, the other issue, of course, is where the AI platforms are getting their information. And I know there's, at least in the United States, there's lawsuits from publishers and others against AI platforms because, in essence, the AI platforms are stealing information, intellectual property from these publications. And I imagine that'll be sorted out in the court, but that's certainly an ethical problem as well.
Professor Lehman?
In addition, one thing that maybe we don't think of is the data that have been used to generate the models. And that's a real issue because depending the data, then you may end up with very ethical problems. Let's say you generate the data on skin cancer on white skin, it will not do the same. And so if you use the AI with not the same context, then you have a problem. And we see that all the time now. I mean, the data that are used to generate the AI model, that's really issue, and then the use of the AI is an issue.
Dr. Mike, how clinically trustworthy is AI? You have been practicing medicine, so your views, please.
Well, my views is sometimes when I have symptoms, I look at, you know, to see. And then you have a list that is very, often very good because it gives you, by rank, the most likely origin of a disease, of a symptoms. But probably that is not enough. That helps a practitioner, but at the end, the practitioner alone is scoring less than ER, and the practitioner with the ER is scoring good, and the ER alone is practicing better if you consider several thousand people. But on the individual point of view, it's a little bit different.
Thank you.
Yeah, I think it's very clear that it's not completely trustworthy. And you know, the information that you're obtaining, you know, certainly it's related in part to how the question is asked, but you know, the information is not completely trustworthy, and we still need to be a little bit skeptical and make sure we're evaluating that information. And again, certainly if we're using such information to make patient care decisions, we need to be very, very careful. One thing, one publication that actually came out of our college very recently, we basically had a contest between our pharmacy students and ChatGPT on how accurately they could answer a series of fairly standard drug information questions. I'm very happy to say that my students won the contest, and we actually published that very, very recently. So at least, you know, there was a previous version of ChatGPT that was being assessed, but again, even basic drug information questions, it's not there yet.
I would say there has to be balance, because we have got only X amount of recall power. We, just before examinations, we study, revise so that we can recall properly just for the sake of exams. But if I have to recall a clinical case, how do I make a diagnosis? I will be able to recall only based on my experience and what I could, you know, which I'm currently involved in. So adopting AI to do that background work, and the way, again, it comes back to asking the question. I would always add a line there stating that from a peer-reviewed resource. If you add that, then it goes to those database and pulls up the information from the literature. So you get to see if some similar case was handled elsewhere, how did they treat the patient? That information it is going to pull out and give an interpretation to you. Then you look at your clinical diagnosis. What does the clinical picture look like to you? Is the clinical picture matching with what it is showing? If it is not, then you got to stop it and then go and do your own research. If there is a match, then bingo, you're in the game. You know how to take the case forward. So that's the way I would incorporate clinical utilization.
I'll ask you one more follow-up question. You have been the person behind India's first drug discovery, which has gone global.
Yes.
I'm pretty sure it has been a very painstaking journey. Bringing a molecule right from the drug discovery stage, preclinical stages, and finally moving it into the market has its own time frame. You have touched upon that. It almost sometimes takes up to 20 years.
18 years.
18 years, there you go. So, given now the propulsion of AI, which aspects of these trials or drug discovery, from discovery to go to market, where exactly do you think AI can come in and help us give a trustworthy, safe and efficacious drug?
I think I partially answered this question when you asked me the first time.
Yeah.
So first is target identification. So you could see when we do not have AI, what happens is we go and search through PubMed or one of those databases and try to find information and make our own interpretation. So the way we assimilate the information is directly proportional to my analytical ability rather than the actual deep analytical power. My analytical power may be very different than yours and yours or yours. So that limitation is excluded here. So the machine does that analysis, so it's much deeper. And based on that information, I can take the next step. So the drug discovery, the first phase is immediately shrunk. And then clinical trials, safety, we do a lot of off-target testing to see whether it is hitting any other target other than where I'm aiming it at, right? In spite of that, have I missed something? I may not know. So if I deploy AI and ask the right question, okay, the target is penicillin binding protein 2 in the bacteria, which is gram-negatively stained, and which other targets can it hit in the human cell? Or which other target cells, which are the microbiota in my body, it can hit? So it can do that. None of us look for microbiota impact. So it can do that analysis and tell me, okay, if you do this, maybe your Akkermansia will come down or Lactobacillus reuteri may come down. So that will help me to see, okay, I got to again optimize the drug. Normally in drug discovery, once you have a molecule, we optimize the lead and then bring in the drug-like characteristics. Now in drug-like characteristics, we never look at what impact it has on the largest invisible organ of the body, which is your microbiome. So that information it can do much better and show us. So it will help in every stage to shrink the time and have a better, more efficacious and more safer drug for human use. That would be my utilization.
Wonderful, wonderful. Thank you. Ma'am, clinical trustworthiness of artificial intelligence. Your quick views on that. Any views? Are we really ready to adapt AI?
Yes. When I have a expert, AI stalwart sitting next to me and giving a promising result, definitely I can't say no to it. Of course, we are taking an infancy step, and I feel a ray of hope. And ultimately, I feel that, to improve the quality of the patient care, whether it is AI, technology, until and unless we are not harming the patient community, I'm okay with it, and we welcome those AI-enabled patient care devices and the tools, decision makings, improvised care, definitely yes.
Wonderful. What could be those safeguard mechanisms that one should look at while embracing AI? We did touch upon the ethical aspects, but we do also know that there are several AI models that are available in the market which do hallucinate, which give out things that which are not well researched. It's all about prompt engineering. So when it comes to either the predictive nature of AI or when it comes to adapting it to a prescriptive pattern, what are the safeguards that we should generally look at?
Yeah, I feel we should not be completely dependent on it, and still they are at least in my field, it is still in the testing stage. And we have all the possibilities of improvising it and not becoming dependency, and multiple areas tested and given a certification that yes, we can go ahead, then it is fine. Till then, we should, though everybody says it is good, as a nursing expert, I feel yes, we need to test it and then approve it, then embrace it. Till then, it is still in a stage of testing. Yeah, thank you.
Dr. Mike, your views on some of the safeguards as clinicians when we are really moving ahead in terms of adopting AI, please.
Yeah, and I'll answer that again from the point of view of patient care. And as you were answering your question, I was thinking back to when I was training 100 and something years ago. And this is when calculators were first starting to become used. And everybody was in a panic that, well, we can't use calculators because we won't know if the answer is right. And if we're applying that to, say, some patient care decision, then we can't trust it. So interesting that that question about, safety of technology is not a new question. And I think, the safeguards, number one, has to be a human has to be involved. And while hope it's still science fiction, that we don't want to have computers making the ultimate decisions for our patients, and again use them as a tool. And we need to make sure we train our students and all the students out there today, and all of you who are educators, so that they know what's reasonable for a patient. So if we're asking an AI platform some question, is the response within the realm of reasonableness? If it's not, then perhaps it can't be trusted, and have those safeguards, just like in the hospital with things like smart pumps that we use to infuse medications. We build in the safeguards so that we can't exceed doses, so that we can protect the patient's safety. So I think it's sort of the same attitude.
Professor Lemon, your views?
I think we need to know the limit of the system and how to use it. It's like a tool, like a hammer. It's maybe dangerous. So, but what is a little strange is that when you ask a question, you realize that when you ask twice the question, the answer is not the same quite often because the way it's constructed. And that's an issue for us for certification.
Thank you. Do we have any questions from the audience, please? Any questions? Yes, please come to the mic.
A very good evening, sir. Actually, my question is related to, as in, for example,
please introduce yourself.
I'm Dr. Divya S. Nair. I'm a PhD scholar. I'm from JSS College of Pharmacy, Mysuru. So my question to you is, sir, that whatever information where we give to AI, though that information comes from us, humans. It's not coming from somewhere outer space. It's what we give. So now when we make a mistake or we make an error in the system while giving the information to AI, it might give results which might not be true. So how do you expect to, how do you overcome such things? Like, what are your strategies that you hold on to overcome this sort of loss of data integrity?
Who would like to take that? So predominantly, I think she's asking about the prompts, the prompt engineering and the safeguards thereof.
That's a very good question, and that's a very genuine doubt anybody should have. So if you recall the question he asked about how do I use it clinically, right? I said, it'll give the information based on what you have fed in, but it can give you information from a broader network of resources than you could reach yourself in that given short period of time. See, if you have to go through like a million publications and come to a conclusion, it will take a month or two for you. But AI would do it in maybe 5 minutes, right? So it synthesizes the information, but then you have to do your own self-interpretation. And to answer the question on the genuinity of the data, now you have to give the right question to it. I told you already, get from a peer-reviewed sources. When I say peer-reviewed, it's though you have published, submit a paper, there are at least 3 to 4 scientists who have evaluated and said, okay, this data looks good. There is nothing called perfection in this. You can never be perfect. Because data is also, by nature of data, it evolves itself also. What you see today, tomorrow if I find some newer information, I am going to change the information as well. But AI will look at both the information and give an interpretation. That is where your personal discretion comes into play, which is based on the situation, customized situation. So that balance 15%, we always say standard error of 15% is allowed. You must play your mind in the 15% to solve that doubt what you may get every time you see that.
I think it's even our responsibility as healthcare professionals or people in healthcare field that we make sure that we give a very right information that is accurate. Maybe later that could be used. So I guess it's responsibility of all of us. The very reason for asking this is currently in pharmacovigilance, if you see, we are taking the data only when the reaction occurs. We're not taking the data of the people who might have taken the same drug but did not get the reaction. So in that matter, like, of course there is loss of data integrity, and because of which later AI might not be able to give the exact information, will not have a perfect comparator to state whether why the reaction has happened. Okay, thank you, sir.
Good one.
Okay. Do we have any other questions? Okay. All right. So thank you very much. I would really express my heartfelt gratitude and thanks to all our panelists today for coming here and enlightening us on the importance and the way we are going to adopt AI into the future. So thank you very much. Thank you very much for your kind participation. Thank you.
Before moving forward for valedictory, let's watch the journey of ICTHS 2025. It may not be a refined video, but we just captured the small moments, how we started, how we traveled, and how we are today. Yes, can we play the journey of ICTHS 2025? Yeah, please. Good to go? Play.
A very good evening, one and all. I'm Ms. Shalini from College of Nursing Sciences.
And I'm Dr. Faber Roy from College of Physiotherapy.
It is our privilege to welcome you all for the valedictory ceremony of ICTHS 2025. Over the past 2 days, ICTHS has truly stood out as confluence of innovation, skill development, and interdisciplinary learning. We witnessed 8 cutting-edge workshops spanning various disciplines of health sciences, offering hands-on learning and enriching practical exposure. Our scientific sessions were equally inspiring, bringing together eminent speakers, researchers, and delegates who shared groundbreaking ideas and perspectives pushing forward the frontiers of healthcare and technology.
Indeed, Ms. Shalini, these 2 days have been remarkable journey filled with knowledge exchange, collaboration, and scientific enthusiasm. We extend our heartfelt appreciation to all the participants, organizers, speakers, and guests who made ICTAHS a resounding success. Before we proceed further, let us begin this ceremony while seeking the blessings of the Almighty.
I now invite Ms. Samiksha and Ms. Maulya from Department of Physiotherapy to lead us in a soulful invocation song.
ಶರಣು ನಿನಗೆ ಶರಣು ವಿನಾಯಕ ಶರಣು ನಿನಗೆ ಶರಣು ವಿನಾಯಕ ವಿನಾಯಕ ವಿದ್ಯಾದಾಯಕ ದೇವ ವಿನಾಯಕ ವಿದ್ಯಾದಾಯಕ ದೇವ ಶರಣು ನಿನಗೆ ಶರಣು ವಿನಾಯಕ ಶರಣು ನಿನಗೆ ಶರಣು ಪಾಶಾಂಕುಶಧರ ಮೂಷಿಕ ವಾಹನ ಸರ್ಪಾಲಂಕೃತನೇ ಗಜಾನನ ಪಾಶಾಂಕುಶಧರ ಮೂಷಿಕ ವಾಹನ ಸರ್ಪಾಲಂಕೃತನೇ ಗಜಾನನ ಆದಿಪೂಜಿತ ನೀನು ವೇದವತಿತ ನೀನು ಆದಿಪೂಜಿತ ನೀನು ವೇದವತಿತ ನೀನು ಮೋದಕ ಪ್ರಿಯ ನೀನು ಗಣನಾಯಕ ಶರಣು ನಿನಗೆ ಶರಣು ವಿನಾಯಕ ಶರಣು ನಿನಗೆ ಶರಣು ವಿನಾಯಕ ವಿನಾಯಕ ವಿದ್ಯಾದಾಯಕ ದೇವ ವಿನಾಯಕ ವಿದ್ಯಾದಾಯಕ ದೇವ ಶರಣು ನಿನಗೆ ಶರಣು ವಿನಾಯಕ ಶರಣು ನಿನಗೆ ಶರಣು
Thank you, Ms. Samiksha and Ms. Maulya, for that beautiful and uplifting rendition. With that divine beginning, we shall officially commence the program.
Now, I would like to request our honorable dignitaries to take on the dais. I would like to invite Dr. Lingegowda, Dr. Manish Paul, Dr. Pushpa Sarkar, Dr. Guru Prasad, and Dr. Vijay Kumar.